So this is talking about Blue Cross Blue Shield saying it will no longer pay for anesthesia for the full length of some surgeries. And then the community note. This post is directly from the American Society of Anesthesiologists. That makes sense. This change follows Medicare billing practices. Anesthesiologist providers very often have been found participating in surprise billing. This change attempts to close this loophole. Wait, so you're suggesting that if Blue Cross Blue Shield didn't bill for the full duration of the surgery, that would somehow prevent surprise billing? I'm not sure if I understand the... There has been significant widespread misinformation about an update to our anesthesia policy. As a result, we've decided to not proceed with this policy change, Anthem told People in a statement. Okay, so they're saying that this has been misreported. To be clear, it never was and never will be the policy of Anthem Blue Cross Blue Shield to not pay for medically necessary anesthesia services. Well, wait, hold on. This means nothing, because the whole point of the story was that Anthem Blue Cross Blue Shield was determining that medically necessary anesthesia services might end at an arbitrary point mid-surgery. Like, medically necessary might mean 8 hours, and past that they're not covered. Like, that's the point is what their determination of necessary is. The insurer added, the proposed update to the policy was only designed to clarify the appropriateness of anesthesia consistent with well-established clinical guidelines. This doesn't necessarily seem like it vindicates Blue Cross Blue Shield. They're basically, like, the initial claim was they're no longer going to cover anesthesia past a certain point, and their clarification is like, no, we'll cover anesthesia up to the medically necessary point. Okay, well, what about past that? Why are you just linking tweets? The point is that sometimes doctors will anesthetize a patient for longer than necessary because they make a lot of money on those, so the policy changes to try to tell doctors they won't pay for anesthesia past a necessary point. Don't you just love all of the medical insanity that comes with our private health insurance system? The idea of an anesthesiologist putting you under for longer so they can charge the insurance companies more? Like, it's completely senseless. Is that a thing they do? I've heard stories. According to Anthem's initial announcement of the new policy November 1st, the insurance provider would have set predetermined time limits that patients that could be under anesthetics during a surgery procedure. After the time limit is up, the patient's anesthesia services would not be covered. Well, yeah. Claims submitted with reported time above the established number of minutes will be denied. That would still mean the person going under would have to pay for it. Okay, so they're saying this is a change they only wanted to make because of anesthesiologists overbilling, but it seems like the consequence of them doing this would still be randomly patients would wake up and then they'd be told that they have to pay the bill. Like, even if the claim is correct that they're doing this in response to improper procedure from anesthesiologists, it seems like it would still come around to fuck over the patient. This update will not change industry standard coding requirements or the American Society of Anesthesiologists anesthesia formula. Well, yeah, of course. Why would it do that? Supposedly this reduces fraud because now doctors won't want to rob patients because they're poorer than the insurance company. How does this improve life for the patient in any way? This would just reduce fraud stealing from the insurance company, which I don't give a about because they already make infinite money. This does nothing at all to help the patients, and it can hurt them. Okay, so yeah, never mind. My assessment was correct. It's not due to widespread misinformation or whatever. They are just trying to get one over on and this is just them trying to make more money. If a patient can't pay a bill, the hospital often just eats the bill. Scheherazade, respectfully, are you insane? Oh yeah, if the patient gets medical debt that then beleaguers them and weighs on them for the rest of their life, like after 8 years of being hounded by debt collectors, eventually the hospital might eat the... Are you insane? All because your anesthesiologist kept you under? The patient their claim gets denied, so the patient has to pay $36,312.15 because the anesthesiologist kept them under for too long? Because maybe they just up, or maybe they wanted to get more of a claim from the insurance company. The company previously said the change was part of an effort to make healthcare more affordable. Oh, I bet. And stop overbilling for anesthesia, per CNN. Yeah, I believe that. I believe a health insurance company would make a change to make your life better. Well, Scheherazade, and whatever solution they settle on, this was not the right one. Evil, evil companies. If an insurance company says the sky is blue, you need to check. Agreed. Policy was the subject of much criticism, including by legislators in the ASA. I would fully believe anesthesiologists are deliberately putting people under for longer in some way to make themselves or the hospital more money. I will fully believe that because I don't like doctors very much. But if the solution that Blue Cross Blue Shield has to them making slightly less than the bajillion dollars they were already going to make that year is to implement a system which could randomly lead to patients waking up and not having their shit covered, then I don't support this solution at all. Blue Cross Blue Shield told some extremely overpaid specialists, median salary $430,000. Oh, buddy, if you think anesthesiologists are paid too much, wait till you find out what the salary of the people who own the health insurance companies are. That they would be cutting their pay by applying some of Medicare's payment rules. That's how single payer works. Squeeze rentier provide. Wait, that's how single payer works? Squeeze rentier profits, lower costs. I'm sorry, at what point was this lowering costs for the patient? These people are, who are you? Liberal, Fox Medium, liberal ass motherfucker. Pharma shill detected. Well, I like how we're just assuming the lower cost part. Like, oh yeah, I know it wasn't even remotely included in their proposed plan, but I'm sure they're gonna pass their savings along to the consumer. I'm sure Blue Cross Blue Shield is gonna pass their savings along. Idiots or shills. Issue is the hospitals can essentially charge whatever they want because it's huge insurance companies that pay for it. Not my problem. So literally, like, it's a psycho system where that is engineered to make both of them insane amounts of money. They're not victims here. You're literally suggesting the health insurance agency is like the victim in this arrangement. I don't give a shit what their dynamic is. They make up numbers and throw them back and forth. They like preferentially, they leech off each other and off the patient, like them. This policy would have enriched Blue Cross Blue Shield at the expense of the patient, which is the only thing that I care about. If anything, the idea that they're screwing insurance companies makes me like the anesthesiologists more. I'm not defending them. I'm just trying to explain that this isn't because the insurance company is just evil. It's because the system is set up where this is the only thing that can happen. There's an easy way to fix this. You approve the claim for a patient's surgery, even if they're kept under anesthesia for longer than expected, but past a certain duration of anesthesia, the hospital just has to eat that bill. So if you are expecting to pay for 6 hours under and you spend 8 hours under, the health insurance company pays for the whole claim, but won't reimburse the hospital for the last 2 hours. That fixes it perfectly. Oh, you can't do that because that would be like financial impropriety, that would like fuck up the contract. Well, then why can the patient randomly be billed? Why is everything designed in such a way that the patient can at any point wake up owing $1 trillion and then like, no, you can only design complicated financial loopholes in ways that benefit the wealthy people, not in ways that hold them accountable to their behavior. Like, but then the hospital will go after you. Well, obviously that would be prohibited because like the full thing would be covered by the health insurance company. They would just not pay that amount and it wouldn't defer to you. It would just be like, well, no, that's not valid. Whatever. We all want Medicare for all here. Hospitals are in the red. Hospitals are in the red because the money is being siphoned by the administrators and owners. Don't buy the easy headline. It is a insane financial maelstrom that would easily fix itself if you just went to a hospital and you got the procedure and the hospital services bills and cost of good and what have you were all paid for by the government, or even with like a sane upfront transaction. It's an insane system designed to siphon money from everyone so like 5 people can get wealthy. It's a gigantic administration bloat. You want to see how bad it is? I bet you can't even fathom. I bet you can't even guess. Healthcare administrators far outpace physicians in growth. 2 lines on a chart. How many physicians are hired versus how many administrators are hired. Since 1975, there are over 3,000% more administrators in the American healthcare system. People do-nothings who do nothing. Their only job is to siphon more money. You pay $1 bajillion for your tonsillitis or appendicitis or whatever, that all gets split among them. It's all intentional. It's not because it's more efficient. It's not because it's a sane system. It's not because some smarter person than you out there thought, well, there are plenty of people out there smarter than you that thought up the system, but they did not think it up to benefit you. What happened in the 90s? A lot of people made a lot of money. This is similar to how colleges are bloated too. Europe. Yeah, your average doctor is not living it up as much as you think, trust me. There are some like super high profile brain surgeons or whatever, but even many of the medical staff that have a relatively high salary, they're paying down a lot of student debt. I'm not saying they're poor or whatever. I'm just saying, like, that's not where the money is. It's just a gigantic financial apparatus, a parasite leeching off this system along with every other one. That's why life hasn't gotten any better for folks, even though we're the wealthiest country in the world with the biggest numbers. Like, we have, the numbers are huge. Where are the numbers? Where are the numbers contained? Well, they're all contained here. It's a crazy system.